Communications, the keynote speaker and moderator for this Interfaith Humanitarian Alliance session on building the resilience of our communities through promoting COVID-appropriate behavior and vaccinations. As you all know, we've been fighting the onslaught of the coronavirus in our community. We are in the grip of a huge health pandemic for the last year and a half. At a time like this, when every indication has it that we will be entering the third wave and cases are rising in various states, including Kerala, it is critical that we turn to our leaders in the community to guide us towards building our resilience and mitigating the impact of COVID. Um, Interfaith leaders, especially, have been playing a very vital role in disseminating information in the community, providing psychosocial care, key messages, disseminating them, helping us build our positive thinking, organizing vaccination drives, drives for medical supplies and food and emergency aid. There's a whole lot of activities that have been generated through faith organizations. And especially in the light of following COVID appropriate behavior and following health and safety protocols. All this is essential towards getting us to move towards herd immunity and being able to battle this crisis better. Sphere India, the Sphere India Interfaith Humanitarian Alliance, it's a platform in collaboration with UNICEF, WHO, HCL Foundation, and World Vision India, and has been organizing these sessions regularly at various state and national platforms with different interfaith leaders for the last year and a half. This is a platform to generate dialogue on critical subjects and spread information on key messages and protocols through our faith leaders that stand in solidarity to combat COVID-19. Today's session has with us some eminent panelists from various religions and faiths. We have with us Swami Narasimhananda from the Ramakrishna Mission. He is presently the Secretary of the Ramakrishna Mission, Kozhikode. He specializes in Indian studies, Indian philosophy, sociology of religion, and religious studies. We have with us Mr. Salim Abu Hanan, who is the Secretary of the Moinul Islam Madrasa, and he's also the principal of the MH Women's College. We have with us Mr. Tapan Dubyahudi from the Cochin Jewish community. He is a linguist and speaks 11 languages. He was a technical analyst in the British Army and is a representative of the Cochin Jewish community. We have with us Father John from the Malkara Orthodox Syrian Christian Church. He is assistant professor and warden at the St. Thomas Orthodox Theological Seminary, Nagpur. We have Sister Anjali Vedavati from the Brahmakumari Association. She's a B.Ed and M.A. in English, Literature and Language from Kerala University. She has been associated and is in service of the Brahmakumaris World Spiritual University since March 2009. We also have with us Father Kurian Matthew, who has done his theology from the United Theological College, Bangalore. He has served as the president of the Christian Leaders Conference Kottayam chapter under World Vision India. We also have, for our keynote speaker, we have today with us Dr. Henna Hijazi, who is the Senior Manager Programs at Sphere India. And the session is going to be moderated by Mr. Mahendra Ramarajam, who is the Disaster Risk Resilience Officer at UNICEF India. So over to you, Dr. Henna, for the keynote address. And we'll take it forward from there. Thank you so much and welcome everybody once again.
Thank you so much, Jennifer. Greetings of peace, Om Shanti, Assalamu Alaikum, and a very good afternoon to all of you all. At the outset, we wish to express our heartfelt gratitude to all the eminent scholars, faith leaders, who have been gracious enough to accept our invitation for being a part of today's session on Interfaith Humanitarian Alliance. Now, as Jennifer told all of us that these sessions have been going on since the last 1.5 years, and they started immediately post pandemic last year, when there was a lot of confusion, there was a lot of ambiguity, there was a lot of mental stress, tension, confusions, and people were grappling with a whole lot of problems. And it is then that we realized how important the role of the faith leaders, the spiritual healers is, who have a lot of trust amidst communities, and for bringing in any attitudinal, behavioral, and bringing in a lot of respite to the communities, how critical and crucial their role can be. So the aim of these sessions have been primarily to bring together national and state level faith-based leaders, organizations to deliberate and jointly respond to COVID-19. While our country has been grappling with COVID 19 from the last 1.5 year, we have experienced unpredictable changes in our lives. The volume of misleading information spreading across the nation is unexpectedly looming larger than the number of people infected with the virus itself. Moreover, the stigma and discrimination, one of the greatest challenges for people associated with the virus, have as well uh, uh, become very rampant and very manifest, and therefore the need for bringing in some kind of uh, a respite in all these issues through some kind of knowledge, information dissemination, and what could be a better way than engaging faith-based organizations, leaders, to be a part of this venture. So as Jennifer was saying, that there have been some key takeaways from around 18 sessions that we did in 18 states last year. Many issues were discussed. I'll not go into the stats of as per the states, but yes, some of the issues that were discussed were what should be the role of religious communities in development projects, how do we build in more awareness campaigns around this, integrated in the community systems, how do we avoid misuse of faith, because it was also about dispelling doubts, dispelling ambiguity. Many of people were completely hopeless, promoting mental health, creating positivity and unity, and promoting COVID appropriate behavior, uh, and not paying heed to misinformation and rumors. While acknowledging the contribution of the faith based healers and leaders who joined us in our battle against COVID, uh, we usually used to send an appeal to people to felicitate the people risking their lives, and also some key messages in terms of how to contain, how to prevent this infection. It's heartening to know that we did an evaluation of the sessions we did last year, and almost 40% of the respondents and participants who were a part of this study have started showing. Have started practicing COVID appropriate behavior. This has in turn strengthened our resolve to be able to take this peace mission forward. And we welcome you all to this very important, very insightful first session that we are doing in Kerala. These sessions are also, as I said, about dispelling rumors, bringing communal harmony, and addressing localized social issues. This is also a moment for us to thank our supporting partners, UNICEF, WHO, World Vision, and HCL Foundation, who have been constantly supporting us in rolling out these initiatives. UNICEF and World Vision both have a very long history of partnering with religious communities of all faiths, and addressing a wide range of issues that affect the society. Now, faith-based organizations are uniquely positioned to promote equitable outcomes for the most vulnerable communities. These are very difficult and tough times, especially with the COVID crisis looming very large and continuing to leave its impact not only in India but globally as well. We wish to salute the spirit of solidarity demonstrated by our faith-based organizations and religious leaders who in these most difficult times continue to play a very critical role in bringing communities together in shared worship and responses. Faith leaders have led by example, demonstrating their leadership by following the safety, physical distancing protocols themselves. Indeed, that has a very inspiring impact on their communities and their followers. They've also been instrumental in uh, appealing to their followers on adapting COVID appropriate behaviors, addressing anxiety, stigma, discrimination, and disseminating correct, credible information and giving it to the masses to help minimize fear and anxiety, whether it is about hesitancy of vaccine, the myths around vaccine, or so many other issues that we grappled with last year on COVID. They've also helped in reinforcing importance of preventive practices in a very sustained manner. Uh, we hand it over to we want these sessions to be very participatory and would want all of you all to speak, to interact, while we have our religious leaders, experts to give in their key messages. But the endeavor should be that we should pledge to support uh, the faith-based leaders and whose role is kind of very humongous, very large in terms of bringing in those changes that usually do not are not so impactful when we as as development partners go to these places, because these faith-based organizations are so well connected and the followers have a huge trust on these leaders. Thank you so much for being a part of today's session. And we wish that our session is very interesting. And we wish to also welcome Mahendraji from UNICEF and request him to moderate this session and take it forward. Thank you so much.
Good afternoon, everybody, and thank you, Dr. Anna. And I also thank all the panelists who have been assembled here, along with participants from civil society organizations, NGOs, to be here to carry forward this dialogue so that we could be of some major support to the state governments and communities that we have been doing for the last 1.5 years during this pandemic. At the same time, for many years, we have been with the community to meet their both religious, spiritual, economic, and social issues that have been addressing to their participation. Today, as we go in for this dialogue on the role that the religious leaders, religious communities could play in the communities in a major way, I thought we could look at two sessions. One is each one of us can get 3 minutes to speak on the topics that we can look at it. Basically trying to see a lot of works would have been undertaken by the respective religious leaders. If we can share what works has been taken up and also what kind of insights and gaps that we have seen during this 1.5 years. And the second part, we can discuss like what measures we could take up, because the governments are also been undertaking numerous interventions and initiatives to look into it. In June, we had this government civil society organization coordination committee being set up across the country to increase the participation of civil society groups. A number of guidelines have been issued, how best we can do it. In the context of Kerala, we are trying to look at is one of the state which had first seen or called or identified COVID-19 case in 2020, and has also been an important state where the government's initiative has been considered as best practice and have been adapted in other states. But even today, we see there are cases increasing. And today, as of yesterday, we had 21,613 cases, especially in Malappuram, then Ernakulam and Thrissur. Kerala is grappling with the situation right from 2020 and continuing to do so. Maybe it's due to its population, or is it due to its health infrastructures, or is it because we have a lot of people coming from abroad quite often because of having 4 international airports? Are we bringing different variants into this, or could be various reasons? Still we are grappling with situation. So I thought we could discuss these 2 important questions. One is understanding what we have been doing and what are gaps, insights that we can learn from it. So I thought we could start with Father John, then we can go ahead after Father John, then we can look into Mr. Tapan, Sister Anjali, Mr. Salim, and Father Kurian and Swami Narsimananda ji as the first question. Then we return in the next place of what solutions we could look into it. So can I, the point of discussion would be for us, what has been our insights, what has been our role, and in that role, what has been our insights, and what gaps that we found that we could learn from it to especially meet the challenges for the Kerala state. Over to you, Father John.
Yeah, thank you. Good afternoon, everybody. First of all, I do appreciate the organizers who conduct this session in collaborating different organizations under one umbrella in order to talk about one of the important issues the world is facing today. Especially the sphere of thought that religions have to do something in this pandemic. Of course, it's there. The ultimate purpose of religion is the well-being of human beings, well-being of the whole beings. While analyzing the purpose of all religions, the well-being is there. So peace is an important element that which comes as the ultimate purpose as the essence of the all religions. In Hindu philosophy, it's said that Loga Samasta Sukhino Bhavantu. In the Islamic tradition, the term Islam means peace, peace to the whole human beings, peace to the whole beings. So, Assalamu alaikum, it means that we are sharing peace. In Christianity also, the term shalom is important. And in Islam and Hebrew, shalom means peace. Peace is not simply a term that signifies a personal comfort or consolation, but it's a wider aspect that the peace, well-being of the whole community or well-being of the whole human and other species also. So in Christianity also, the peace and love is coming together. So the well-being and healing of a person comes as an important aspect which all religions are dealing with. So healing is considered as an important theme that we have to achieve by hand in hands and to going together. So the different dimension of that, the term healing, the physical healing is there, the psychological or emotional healing is there, the sociological well-being of a person is important. Spirituality is a term that which combined all these together. So the Christian view in that caregivers are the persons who are taking in the process of the healing, taking part in the process of the healing. Caregivers are the important persons who are taking part in the process of healing, that which we feel as an important concept. The point which I have to mention here is that messages that can be given out to the caregivers and families that are grieving their losses and are facing challenges related to death, health, and livelihood. So, first of all, I would like to say caregivers are the partakers in the process of healing. Second, the dignity of the caregivers is important. Give dignity, give respect to them is a humanitarian consideration. It has a spiritual value also. Third thing we should try to make is special meetings and occasions, salute the caregivers and to support the caregivers. Fourth thing, it's the duty of the communities to give support to the caregivers' family who loses their lives in the flow of the pandemic. And fifth one is lessening their workload is the duty of the common people. So the religious community has a lot to do in lessening their workload, the caregivers' workload. So by training in taking the COVID protocols in the church premises or the temple premises is important. The religious leaders are to teach how we can maintain the COVID protocols in the daily life. Most of the people are going like that. Nowadays, because of the density of population of Kerala, it's bitter hard to practice all these things because most of the common places are crowded at the time of certain occasions. So it's a duty of the religious leaders to control the public gatherings with a sense of thought. So see, the moderator has said it's a dialogue. Dialogue means dialogue. The term itself has a wider meaning. Moving together. Dialogue. It's coming from dialogue. It's not with two persons. It's a term that which dialogue, which means moving together. So the religions have to move together. Participate in the dialogue means moving together to take care of the whole human species. Because during this time of pandemic, a new awareness is coming out. All are human beings. We are small. We are very much silly compared with other species, while compared with the other microorganisms. So we are in a web of relationship. In a later period, we feel yes.
I think you have another 30 seconds, please. Then we can get to others here.
Yeah. As we are in a web of relationship, we have to talk together, work together, and to during the time of pandemic and other natural calamities, the cooperation with religious leaders is important. It's visible at this time. So thank you all for giving me such a opportunity to talk with and work with you. Thank you.
Thank you for that, John. We'll come back again to see how best what solutions we can look into it. Can I request Mr. Tapanji to come in, because the focus would be what has been our actions in the last 18 months and what were the insights as a community leader, and what gaps do you foresee in the present situation? Over to you, Mr. Tapan.
Thank you so much for having me, dear Abe, and to everyone in the Sphere India NGO. I hope all of you can hear me. Is it clear, Abe? Yeah, great, nice. Okay, right. So thank you so much, everyone, for being here. And it's one of a kind of a gathering, isn't it? Where all of us have gathered around in this melting pot of ideologies and religions and faiths, over to concentrate on the solution to find the solution for one single problem. So it's a combined effort, as Reverend Father Yohanan John just mentioned, that it is actually a dialogue where two forces, or in this case, multiple forces, come together to mitigate a problem, which is already in the process of mitigation. So the agenda for today is the measures and actions that we have taken as communities in the past 18 months to mitigate this crisis, which has equally affected all of us. I'd say as a very tiny community, the Jewish community, we have had the opportunity to do quite a few things, I'd say, as in our focus was on the vulnerable group, the economically marginalized group. And unfortunately, India has a lot of them. I believe that India is the first in the world when it comes to people who are underprivileged, and they are all around us, especially in Kerala. including the migrant workers and a lot of people from different backgrounds who have lost their livelihoods, who have lost absolutely, they have nothing left, no money, no food, no shelter, and such people who are really in the plight. And we have been looking at the news in the past few days about the plight in Afghanistan. And I wouldn't say it is even comparable, but it is very similar to what a lot of the homeless people had endured in our country in the past 18 months. And I think we were really blessed to extend a helping hand to them. And also Reverend Father Yonan John also mentioned one more thing about caring for other species and not just interhuman. So we also had the blessing to look out for other species, as in the stray animals on the street. We know that, again, unfortunately, India has a lot of stray animals on the street. Cats, dogs, birds included, every other animal that you can think of. And all these years, they've been having a very continuous supply of food, which is necessarily not a good thing as well because of the way situation. But still, they've been surviving all these years, and suddenly it has, come to a halt. And I think it's up to us to extend a helping hand to them. And I was very pleased to see and to collaborate with a lot of animal advocacy groups to take these injured animals to the animal hospitals and to feed them, etc. So I think that's also a very wonderful initiative that all of us need to look into, not just into humans, but also to other species as well. They are all compatriots in our world. And of course, not just food and water, but also clothing. We've had the opportunity to donate clothing, blankets, etc., to a lot of homeless people in and around Kochi. So really proud of that. And at the end, I would also like to, I'm not taking too much time. I hope I'd love to sign off by saying that the end result of all this, it all comes down to one single concept, which all religions and faiths gathered around here practice. It's called charity. It all comes down to charity at the end of the day. And in Hebrew, it's called sadaqah. In Aramaic and Syriac, it's the same word, sadaqah itself. In Arabic, it's zakat. In Greek, it's philanthropia. And it's basically the same concept. You can call it, in Sanskrit, it's dana. And at the end of the day, it's the same thing. And that's what unites us. We might be different faiths, Jewish, Christian, Muslim, Hindu, Buddhist, and Baha'i. It doesn't really matter. At the end of the day, the principles are the same. The aim is the same as, again, as Reverend Father Yonan John again mentioned about shalom, peace, salam. These core concepts are the same. And as Pandit Jawaharlal Nehru once said, in unity, there is diversity. And in this Zoom meeting and in this initiative, I see that exact same thing, unity in diversity. Thank you so much. And with the help of God, we will conquer this process.
Thank you very much, Mr. Tapan. Can I request Sister Anjali, please?
Om Shanti, greetings of peace.
Thank you, Sister.
And it's very nice, and I'm thankful for being here in this platform. And I would like to explain that in Brahma Kumaris, we have regular classes, and everybody who follow Brahma Kumaris, they come to our centers personally to listen to the class daily. As soon as the pandemic hit across the world, we stopped all coming, we suspended all the services in that manner and started online classes. So people can stay at home and then listen to the classes. And there was a lot of online classes going on. And now when I say about this, you may wonder why Sister is speaking about the classes. Now, Brahma Kumaris, let me give you a one-line explanation of what we do. We look into the problem of shortage of happiness, shortage of positivity, more than shortage of needs or money. So we definitely have a branch working on that part, but mostly it is the shortage of happiness or shortage of humanity in people. So one thing is, the best part was we suspended all the services, going out or coming in, everything was suspended. but we were giving out the online classes, and through internet and media, we were getting in touch with the people, and through the YouTube media or the Facebook media, we were trying to get in touch with many people who are not followers or who doesn't come to meditation or anyone in the world. And the responses were very, very nice, the huge also, because what is needed is first help our own self, and then we will be able to help others properly. Like many of us have been to flight in plane, and when they give the instruction, the instructions are very clear that you help with when it is the part of oxygen mask. They say that first put oxygen mask on yourself and then try to help others. And you know what? The picture they show is that of a child and a grown-up person. The grown-up person should put the mask on himself first or herself and then try to help the child. So what I am trying to say is the most important part is we keep ourselves safe. Safe from what? The negative thinking. Like sister in the beginning when she was giving the keynote address, she said that there was a huge uprising in negative news spreading around. Oh, it is happening there, this is happening there, this happened to so many people. And it actually, when we think like this, it's actually affecting our mental health. If our mental health is affected, the physical health, whether it gets affected or no, it's the same thing as deceased person. So we were putting in all our efforts to keep people positive, and first thing, be positive myself or ourselves, and then send out the message. So that part, it was very, very impactful that stay positive, then positive in terms of mental health, not the COVID thing. And it worked very well. Now, what is the challenge we are facing is lots of people are losing their their own relatives, which is affecting. And for that, a little bit prayer preparation is needed. I'm not sure how far we have time for prayer preparations. At least we can start from now that life is a journey, and we will, some of the people who are in our compartment, they will get down in their stations and they will take up their own journey, which in short is called death. Death is not the end of anything. It is just a new starting. It is just the change of dress we are wearing and the address we are holding. So this is one thing which is difficult for everyone to accept, and unfortunately we have to accept also. I'm not saying look forward for death. No, I don't mean that. We have to be careful, but again, we have to be understanding also regarding the spiritual side of everything. Change is inevitable. We focus on the positivity the COVID pandemic have given us, that is time for ourselves and time to think about what we were missing, etc., etc. Along with that, spend some time for praying by our own self, so that we can send out the vibrations of peace. One of my brothers, he was saying that about peace, yes, peace starts from ourselves. It is not going to come from our outside. Peace is not a chance, or it is not a gift. It is a choice I make, each one of us make. If we could be peaceful and then try to help others, it's going to have a much wider impact on everyone else. So these are the things I learned. Personally, we learned in Brahma Kumaris what changes we made and what are the challenges, the areas of improvement which is required. And one more improvement I would like to say is, if media could reduce the exaggeration of negative news. I'm not saying don't show negative news, no, but the exaggeration is very, very high, which is impacting, which is affecting the people around us. I wish if it was low, then we would have been able to tackle the situation in a much better way. Okay, that's all.
Thank you, sister. Thank you for this note on talking about positive and overcome negativeness. So can I request Mr. Moin ji, please? Mr. Salim, please. Sorry. Mr. Salim ji. You're muted, Mr. Salim. Please unmute. Yeah. Thank you.
Thank you. Thank you. Thank you. I will just thank you and very good afternoon, all the colleagues, panelists, and all participants who are in the webinar. I will just try to say something on the matter mentioned before. In the session, we are offering tribute to the great frontline warriors of us in the battle against the pandemic, the COVID-19. Okay, can you hear me?
Yes, sir. Sir, please go ahead. You can come a little closer to your mic and we can.
Okay, thank you.
Thank you.
We the human beings, every religion teaches the world about peace. Peace is the essential of every religion. We are human beings of the whole globe are facing the ferocious aggressiveness of the pandemic in intense way. We in the whole society are afraid of the disease in every moment. We cannot speak to others with ease. We cannot gather without fear. We cannot be together without fear. We cannot be together and share our pleasure. At same times, we are like in prison where everywhere freedom renewed every moment is in the fear of others. We cannot believe the air that we take in, the air we drink, the vehicle we travel, the dresses that we wear, everything must be cared vigilantly. The number of the deaths have been frightened as for around 2 years. The pain and the sufferings of our neighbors, our relatives, friends, and the people around the world makes us sad and pathetic every day. COVID-19 is coming back in multiple countries in series of recurring waves. India is just recovering from a very devastating second wave, and there is already alarm being raised for a third wave knocking on the doors. Scientists and health experts say that there is only one solution to prevent or at least reduce the effect of the pandemic. Get all eligible people vaccinated till this happens, and even afterwards, what can so people is following COVID.
Salim ji, I think voice is breaking.
So, my dear, or it's not range for
Voice is breaking. Could you come little more closer to the mic? Sorry to bother you. Yeah.
Okay. In this moment where everyone are effort of other, even to shake the hands, speak closely to the doctors who dedicate their times, energy, and the precious life, daring to come into front line of the battle against the deadly virus must be remembered, must be appreciated. So I conclude my words. Okay, thank you.
Thank you, Mr. Salim ji, for this note on the situation where fear has been part of our life the last 2 years. Can I request Korean, please, to come in?
Yeah. Shall I start?
Please go for Korean. Yeah.
Thank you. Thank you, Mr. Mahendra Rajaram. I'm so delighted to be part of this panel discussion to express my views on the ways to foster the community resilience. I think the starting point should be the basic role of religion in the society. In my opinion, the prima facie of the religion should be rehumanize the dehumanized. Wherever dehumanized elements are there, it's like in a global pandemic or a war or a famine. So the focal point of the religion should be rehumanize them, humanity. Being a Christian priest, I think I should start with the Christian attitude towards humanity. Let me tell it in 2 points. Number one, in Jesus' ministry, he said he placed humanity in the first place above mere law. And the second point, the methodology of law, he replaced by methodology of love. So with this perspective, let me come to the point of resilience. Corona actually affects us in many ways. The only way to make a resilience to this global pandemic is through the vaccination drive. In Kerala scenario, as far as the resources said, in these days, the vaccine drive is at its peak. In Kerala, almost 98% of the people are religious people. And I think our religious leaders are doing a wonderful job making them aware that the need of the vaccine. So through our guidance, we can make or we can foster the people vaccinated as early as possible. I think that's the only way to solve the problem of the higher number of patients at Kerala. I think for the vulnerable ones, we should collect a database from the local governing body and could arrange vaccine drives at our local places to give to care the vulnerable ones our places. Actually, we have done it in our church. In Kerala, I think most of the people are aware of the importance of vaccination to protect from the global pandemic. But there are informations about certain fanatical, notorious groups. They hinder people from vaccination, but very less. So on the one hand, let us work together for the integrity of humanity for the time being through vaccination drive. And on the other hand, let's promote the importance of vaccination through our platforms. So let's use our potentials and promote the importance of vaccine, life, and humanity in these days. I'm congratulating Spare India for arranging such a wonderful platform. Thank you. Thank you.
For Korean, thank you so much. Can I request Swami Narasimhananda ji, please?
Namaste to all of you who have assembled here to talk on COVID and what we have been doing and what would be the course of action to be taken in the future. Thank you, Rajaram ji, and I thank Sphere India for organizing this event and particularly doing it in a particular contextual approach, state by state. And that makes sense because every state has its own problems and the federal system of governing India, it makes good sense to approach this problem state by state. In Kerala, Ramakrishna Mission has been battling COVID in the sense we have some medical units and we have a hospital. And so we have started treating patients who are affected by COVID in our hospital at Thiruvananthapuram. And we are also spreading awareness about how to be cautious, what are the best practices to be followed during COVID pandemic. And the one problem which has been faced is people are somehow considering prayer or meditation to be a substitute to best health practices. And that we are cautioning people that that's not going to happen. One has to, of course, pray and meditate and practice all the meditation or spiritual disciplines, but then that is not going to be a substitute for the best health practices. And also a lot of misinformation, as in the beginning it was rightly pointed out. There is much misinformation existing. Particularly, we are now living in the times of WhatsApp University. And so people come up with ideas like such and such a medicine is a cure for COVID. And even vaccine, I have had vaccine, so I don't have to take care of the best practices which are to be followed, like wearing the mask or using sanitizer, being careful, maintaining social distancing, etc. So these things have to be repeatedly told. And we have seen that it is best to have these things printed and displayed at prominent locations of the place, wherever it is a place of worship or the office where people come. And so also leading by example. So one has to be really careful how public meetings are held. Even if the number of people attending are few, we send out a message when we have a photograph without a mask, when we have 4 people without wearing masks. So that is a responsibility faith leaders have to take very seriously. And though it is true that life is impermanent and that it is a transitory thing, but it is really sometimes insensitive to just say that just at the face of a person who is battling with COVID, who has lost near and dear ones. And the other thing which is coming up on a massive scale across the world is the rising psychological
Swamiji,
ailments. Yeah.
No, for a second, you were we couldn't listen to you. Sorry. Go ahead.
Can you listen to me now?
Yes.
Oh, might be an internet problem. Sorry.
Yeah.
So the other thing which has been looming large now, and it has become a big problem now, a massive problem, is the psychological ramification, the psychological effect of this pandemic. And somehow 1 year and more than a year, about 18 months or so, we have been battling pandemic very well. But now, particularly the youth, particularly children, they are becoming restive, restless, and it is becoming important to engage them in really, really meaningful ways. One thing, the state of Kerala, the government of Kerala came up with a really good system of delivering education even during COVID times. I think Kerala is the first state to have brought the ICT or the technology in place to deliver education even during COVID times. Many states followed suit, but then people are now facing, both the teachers and also the students are understanding that it is becoming impossible or very difficult to engage children there. And so that is why we need to find meaningful ways of engaging the youth, engaging different family members, because we are almost sitting on a time bomb. Because of COVID, already there was a rise of psychological ailments thanks to the technological ramifications, social networking sites, etc. And COVID has only increased the pace of that problem. So this is one insight we got. And also we have also been doing distribution of ration kits, distribution of other material, distribution of technological equipment like TV or mobile phones for people, students who are unable to study because they don't have access to these phones. And other thing which we have been doing is giving a support of counseling to people who are perplexed, don't know what to do. Kerala has seen a big influx of migrants from abroad, people who have returned to home from abroad, particularly the Middle East. And so there are now suddenly we have a huge workforce who is unable to adjust with the situation of the job market in Kerala. So that also we at the Ramakrishna Mission are trying to find out how to reorient them, how to give them some orientation, some kind of training where they can have some attitudinal correction and rethink their choices and also have a better psychological health. And going forward, we think we have to give more concentration on, because the public distribution system and also the food crisis has been handled very well to a large extent. But we have to focus now on how to creatively engage the youngsters, the school-going kids, and also how to creatively engage the youth, so that this COVID does not take us into a different problem of empty minds having nothing to do and they becoming devil's workshops. Thank you. Thank you for this opportunity.
Thank you, Swamiji. And thank each panel member for the beautiful insights, and to also to talk about the ground realities that we at present facing. At one end, there is fear to talk. I mean, it's even me being in the frontline work, sometimes there is a fear because you have to come back home, and what is the situation calls at home, I'm not sure. Some of family members got affected, some family members died. Yes, there's a fear. And also we are seeing now, as Swamiji was talking about, the children. Initially, they were very much active and they were involved in a lot of, my own son was active in the class. But nowadays he says too many activities are being shared and I'm bored with it. Kab dekho activity de raha hai. Kab dekho activity de raha hai. Because they feel it is little burdening them. There are issues that has brought out in specific to Kerala in terms of the Middle East brothers who are coming and sisters who are coming because they lost jobs. How do we engage them? We have migrant workers from Orissa, West Bengal in Kerala. How do we engage them? The youth and children, how do we engage? The state has been doing a lot of work along with the civil society groups, religious institutions, by offering their staff, by allowing their hospitals, primary health care centers, dispensaries to be part of the health force. There are a number of actions that are being taken across by every group that we come across. At the same time, as panel members were sharing, there are issues where people are hesitant because of various biases, because of misinformations, because of understanding that is against their own thoughts. So these are to be engaged, these are to be dispersed in their thinking. As we are talking about all these issues, an important aspects that we come also to importantly to discuss is both the prayer and spiritual discipline goes along with the behavior change and also health discipline, which is very critical for us if we need to address this COVID-19 virus transmission. That is only possible only if you have both, as panelists were talking about, the peace within is important. The way we engage ourselves in prayer and spirituality is important. At the same time, when we are in a physical context, when we are in the public places, if we are with our colleagues, if we are with our neighbors, if we are with our workforce, then what kind of a health discipline that we need to follow becomes very critical. So in this context, I think a lot of information has been shared, but I also request other participants who are present here, if they like to throw some light or have any clarification points or questions to be discussed with panel members, it will be important. This 4 o'clock, I'd request all the panel and the participants if we can stay for another 5 or 7 minutes so that we could complete the process by taking 2 or 3 questions. And finally, we look at what important steps that we can take up to address the possible new wave that may be there, because we have new variants emerging in Maharashtra where cases have been identified with Delta variants. We also see the opening of many public places to the public to go around, when we are still not completed the second dose of oxygen to large majority of those who are taken first dosages, and there is a large community of children who may require safety and security against this health. So I request one or two of our colleagues who are in the meeting to share or talk any questions for a minute, please.
Mahendraji?
Can I ask a question?
Sure, go ahead.
Yeah, so it's directed to Swami Narasimhananji. Swamiji, children have been most affected during the COVID-19 pandemic, and they're facing a lot of psychosocial issues. They have seen so many deaths. They cannot go to school, cannot meet their friends. I wanted to know if there are any initiatives that have been taken to take care of the psychosocial support, psychosocial health of the children or their caregivers.
Yeah, thank you for the question. It's a very important question, as I was hinting while I was deliberating. That is a two-pronged approach we have taken. One is towards the parents, because more often than not, the problem arises with the parents, the culture, how it is there in the family. And also, we are now thinking of, with under medical supervision and medical care, we are thinking of how to bring our children to safe spaces where we can create a space which is sanitized in a very protective manner. We can bring out these children, and at a very, very restricted manner, we can make them sit out in the open and talk with their parents and maybe one or two selected friends. And that is one way to de-stress them, because children, they need a lot of tactile perception. That means they need touch, and also they need touch with nature. So for more than 18 months now, they have caught up in the homes. They are bound there. They are unable to go out. And so it is causing a lot of nervous breakdown even in many places. In fact, we also had instances of some suicides among school children, even in the city of Kozhikode or Calicut. And that happens because they have nothing to do. And most often middle class or lower middle class families don't have big houses. So there is no space really to move. There is no space to negotiate. So this is one thing we are doing. We are trying to creatively engage, create virtual platforms where we are creatively engaging with parents and children at the same time, at the very same platform, and also bringing children along with their parents to a safe space, which is like a sanitized, medically supervised space where they can come out. It could be a small garden, it could be a small chapel, it could be some such cozy space where they come out and they have a purpose to talk and they interact, and there's some creative engagement. And it is very important because we have been toying with various kinds of things, and we found out that no other alternative worked well. And also, this is a time when we can pass on those manuals of values which we have in various religions to these kids, remove the religious color and just give them the ideas of values, and like the teachings of Swami Vivekananda or the teachings of some such other leaders, and then give them an inspiration. They need motivation. Children, we all know, they emulate what they see. And so now, because they are in the house, they are only seeing familial quarrels. And because financial crisis is there, there is always some ruffling going between the parents. So we need to bring them out in a very, very monitored manner. As Rajaramji said very well, even in Kerala, we have seen in Palakkad some cases of Delta. And so different variants are coming in. So we have to take care of that also. That is one way of engaging. And we are hoping that that brings some change. And also, all the clinical setups where we have, like here also we have a polyclinic in Kozhikode, we have many polyclinic setups, we have a huge hospital in Thiruvananthapuram. We are trying to engage kids who are coming to the hospitals, who have to come to the hospitals for some treatment. We're trying to engage with them. We are trying to create some moral kind of space, some creative engagement, critical thinking, asking them questions, try to make them generate something, not as an activity, which rightly Rajaranji said, people are now fed up. Children are fed up with activities. Today, this teacher is giving me this activity. The other day, that teacher is giving me some other activity. So asking them to create their own creative spaces. And like one way is painting, holding virtual painting exhibitions, holding virtual cultural festivals, asking them to come of themselves some ideas. It could be anything they like to do, and presenting it and putting it, showcasing it on the social media. All these endeavors, we have had huge response. We run a kindergarten here, so there also we try to do this, and it's a huge response. So at the end of the day, what matters is that the child should be creatively engaged, and we should not allow the psychosocial health of the child to deteriorate. Thank you.
Thank you, Swamiji, and thank you, Abhay, for this question. As we coming to the concluding thing, there are a couple of issues. If I could request the panel member, if there's one measure or one suggestion that you could make that we can look into it as a group, not only as interreligious faith organization.
Yeah, I don't think we can hear you.
Sorry, can you hear me now?
Yes.
Yeah,
yes.
What I'm trying to request all the panel members is one measure or one suggestion that could go into our discussions, and also to take it up as a part of our work in the state of Kerala. If I could start with Father John and end with Swamiji, one action that we could look into, either for vaccine or either for promoting vaccine or for the COVID appropriate behavior, whatever we may have, one action that you could suggest that we can all follow up. I also would, this suggestion that I like to make, there are a large number of networks across the country, like Spear Interagency Group. We have Oxygen Network, which were supplying oxygens across the country during the worst period that we went through. There are groups that are working now to build and promote vaccination across the country so that we could reach the vaccination to all eligible people at a record time. So they're trying to look at it. We need to expand our horizon and link it. So may I request our panel members, starting with Father John, if one sentence or one action that we can take it up, please.
Yeah. As I observe, there are a lot of webinars and web prayer groups and web worship groups are working nowadays. So most of those groups are limited to the religious activities now. So the COVID pandemic make a new shift to the online area. So we can make use of that online groupings of the religious communities in order to spend a few minutes to talk about the importance of vaccination, importance of the COVID protocol systems, and we can also, the NGOs such Sphere Group or other organizations can join for 15 minutes or 10 minutes about the value of the health system nowadays. So it's a suggestion for you.
Thank you so much for it. It's a very brilliant idea. I think we need to look at it. Yes, Mr. Tapan, please.
Well, I was extremely enamored by Anjali sister's suggestion and her reinforce on the topic of giving happiness to people, because that's the first step. Happiness and mental health, that is at the end of the day of paramount importance. Without it, everything else is an empty shell. So the foundation of happiness at the end of the day is of paramount importance. And her words reminded me of the country of Bhutan, which is our neighbor to the northeast.
Tapan, one suggestion, please? Any suggestion?
Yes, I'm coming to it.
Yeah.
So the suggestion is that what we are doing right now a Zoom meeting, a group discussion, a dialogue focused on mental health, focused on the happiness, focused on mitigating depression. As Swami Narasimhananda said, the number of suicides are increasing, especially among young people, not only in India, but I heard in Australia and Japan too, young people are committing suicide because of the depression they are having. So that is the first thing we need to mitigate. So such classes and group discussions and dialogue-oriented programs focused on mental health and happiness would be of paramount importance. That is the message.
Thank you. Thank you, Mr. Sister Anjali, please.
Om Shanti. One suggestion is we all have branches across the state. So if possible, if with any negotiation with the government, if we could make our branches COVID vaccine places where vaccine could be taken, that would be great, so that the vaccine reach every corner. Along with it, like Swamiji said, the rules of how to take care of the pandemic, the rules we need to follow could be printed and given to them. Plus, they could, one more suggestion is the webinar or the common prayer thing. That will be much better. Today also, a lot of people wanted to join, but the registration part was a little bit difficult. But else, it would be a very good platform to spread the message of positivity as well. Thank you.
Thank you, sister. Mr. Salim, please. Mr. Salim ji, for the Korean.
Yeah. In fact, it was one of the very interesting sessions. From my side, what I would like to suggest is, of course, now many NGOs and other religious institutions, especially as mentioned by Swamiji, what they are doing. Of course, these programs are there everywhere, but somehow these programs are in some pockets. It's not coming up to the cream of the society. So I think we could have some programs through which we could have a coordination with the government authorities at the local bodies. I think we could have a good result because the time is less. So if we have a mind with that aspect, I think that could be resulted out in a very good result, and we could fight against this disease in a very effective manner. Thank you.
Thank you. Swamiji, your thought, you already shared a lot of points. I've already noted it down. If anything, final word?
I won't say it's a final word because
no, for this discussion, sorry.
yes. We are yet grappling with this COVID. And so also remembering that we are yet not clear about the nature of this organism, this COVID-19 virus or whatever it is. I think we should create spaces where the youth, the children, and also the teenagers, they can talk, because that has been a big stress, a point for stress. So let us create spaces where they are not told things, but they can talk, they can open up. And the sooner we do this, the better, because as I already said, we are sitting on probably a time bomb because of COVID. So if we can all synergetically come together, and if we can create spaces where the youth, that is till 25 years of age, they can talk, they can just open up.
Thank you, Swamiji. Thank you very much. I think the ideas are something very innovative and possible to do, especially one that we bringing children in an open space, maybe in a football ground, hockey ground, allowing them in a sanitized place so they can express and go around. Making most of the churches, mosques, temples, or institutions, chapels, etc., to be where people come, vaccination drive can be taken up, so we complete that demand that is required for people are coming forward. And looking into COVID appropriate behavior, linking between various groups, as Father John was saying. There are people, there are TV programs, prayer meetings, um, pujas taking place through televisions and YouTubes, where they can be part of where promoting COVID appropriate behaviors could be talked about. Most importantly is the psychosocial support that is very critical now. All the panel members have spoken. There is a need for this particular support because we need to deal with these children, need to deal with youth and parents, as we're saying, and there is a much demand, and we need to initially look, on a priority basis, work on this particular thing. I thank all of you for spending your time, and we'll request Jennifer and Dr. Reena to conclude the meeting, please. Thank you.
So thank you, everybody. I think this was a very insightful session. Thank you so much to the eminent panelists that have come and spent their precious time with us. We really got much out of it. And thank you, Mahinder ji, for moderating the session and really bringing out very important pointers from each one of the panelists. I think the measures that they have suggested are of very are quite invaluable, and I'm sure that there's things that we can do and plan according to these. I also think that the initiatives they've highlighted have really been. I mean, it's every time we have one of these meetings, we find out so much more about what is happening at the ground level in that various state. So I think this has been very insightful. It's a great session to have, and to have so many diverse groups of interfaith leaders speaking to us at the moment and giving us their views on what is happening in Kerala. Again, from Sphere India and from the Sphere India Interfaith Humanitarian Alliance, I thank each one of you, including the participants and the keynote speaker, for coming together today to make this session successful. Thank you so much.
Before Jennifer, before everybody going, can you please put on your video so that we could take a photograph, please?
Oh, sorry. No, that's okay. I'll merge this. No problem. Thank you so much.
Thank you, everybody. Have a good day. Take care, everybody. We will meet soon, because I also had requested. Finally, there is one gentleman whom I've been coordinating, is Kalan Gowda, who is trying to work with the civil society groups across the country to reach about 10 to 20 million people on vaccination. So you'll also be there. You'll also support institutions that are interested, so that we can reach every nook and corner for vaccination. Thank you.
Sure.